What should you ask neurosurgeons about awake craniotomy? If you or someone you care about has a brain tumor and your doctor suggests an awake craniotomy, it's natural to want to know more. Asking the right questions can help you understand the procedure, its benefits, risks, and what to expect. First, ask why an awake craniotomy is recommended for your specific tumor. Find out where the tumor is located and why keeping certain brain functions safe is important in your case. For example, if the tumor is near areas controlling speech or movement, an awake procedure might help protect those functions. Next, ask about the advantages of an awake craniotomy compared to other brain surgeries. Understand that being awake during surgery allows surgeons to map your brain in real time. This helps them remove as much of the tumor as possible while minimizing damage to critical areas. It can lead to better outcomes and fewer long-term effects. It's also important to discuss the risks involved. Ask about possible complications like infection, bleeding, seizures, swelling, or temporary changes in speech or movement. While serious complications are rare, knowing what could happen helps you prepare mentally and physically. Ask what will happen during the awake part of the surgery. Find out about brain mapping, which involves asking you to perform tasks like counting, naming objects, or moving limbs. Clarify how long you will be awake and what sensations you might experience. Remember, the brain itself does not feel pain, but the scalp and skull are numbed with local anesthesia, so you might feel pressure but not sharp pain. Learn who will be on your surgical team. Typically, a neurosurgeon, anesthesiologist, neurologist, and sometimes a speech therapist will be involved. Ask about their roles and experience with awake craniotomies. It's also helpful to know how your comfort and anxiety will be managed. Find out if sedation or other support measures will be used to help you stay calm and comfortable during the procedure. Understanding the recovery process is crucial. Ask about how long you might stay in the hospital and what your recovery timeline will look like. Discuss the likelihood of complete tumor removal and what options are available if some of the tumor remains. Follow-up treatments like radiation or chemotherapy might be necessary depending on your diagnosis. Long-term effects are also important to consider. Ask about potential changes in speech, movement, memory, or other cognitive functions after surgery. Find out what rehabilitation services are available to support your recovery. Preparing for surgery involves knowing preoperative instructions, such as medications to avoid, dietary restrictions, and what to bring to the hospital. Postoperative monitoring is key. Ask how your progress will be tracked through follow-up visits and imaging tests. Be aware of signs of complications to watch for after surgery, such as severe headache, confusion, weakness, or seizures. Knowing when to seek immediate medical help can make a difference. If possible, ask to speak with someone who has had an awake craniotomy. Hearing about their experiences can provide reassurance and insight. Finally, inquire about your surgeon's experience with this procedure. A surgeon with extensive experience can often provide better outcomes and answer your questions more thoroughly. Asking these questions empowers you to make informed decisions about your care. It helps you understand what to expect and can ease anxiety about the process. Remember, every patient's situation is unique, so always consult your healthcare team for personalized advice tailored to your specific diagnosis and needs.